A new report predicts the U.S. will reach a tipping point in vaccine enthusiasm in just a few weeks, meaning supply will outstrip demand. Biden unveils a new stimulus plan to incentivize vaccinations. More states banning vaccine passports. South Dakota and Arizona join a handful of states that bar the passports. And a WHO panel also recommends against them. The U.S. isn't expected to make a decision on the American J&J vaccine until Friday, but overseas, Europe is going full steam ahead. And more schools are requiring students to get the shot to set foot on campus, including most of the Ivy Leagues. Tune in to Deep Dive as we explore these topics and more. Hello and welcome. This is Deep Dive and I'm Tiffany Meier. Let's talk about vaccines. Vaccinations across the nation is slowing down. Biden announcing the U.S. hit the goal of 200 million shots in his first 100 days in office. But the next 200 million aren't going to be as fast. A new report from the Kaiser Family Foundation predicts in just a few weeks the U.S. will reach a tipping point in vaccine enthusiasm, meaning supply will outstrip demand. Citing its own poll and others, the report found that the tipping point could be any time within 15 to 28 days. As per the New York Times, a Wyoming health official asked his state to stop sending vaccines due to the freezer already being full of doses nobody wanted. Iowa also had so many doses that volunteers were told to stay home, as too few people had signed up for appointments. And a Pennsylvania hospital set up a drive-through with 1,000 doses, but only 300 people showed up. The New York Times noted the places with low vaccine enthusiasm are places that voted primarily for Trump. Polls also show a similar trend. Monmouth University and Quinnipiac University polls show nearly half of Republicans had no plans to get vaccinations. Among Democrats, that number dropped to around 1 in 20. They warn it's not enough to achieve herd immunity. To combat that, Biden is encouraging vaccinations with his favorite approach, another stimulus plan. This one would offer tax credits to small businesses that give employees paid time off to get their shots. Biden says the benefits will be for businesses with less than 500 employees. Former FDA Commissioner Scott Gottlieb estimates not enough Americans will get vaccinated to achieve herd immunity, but he says it is enough to substantially reduce the spread of the virus. Now, more states are pushing back against vaccine mandates. First up, more states banning vaccine passports. South Dakota and Arizona are the latest states to join in the pushback. South Dakota's governor said on April 21st that she has taken executive action to ban the use of digital or paper vaccine passports. The order bars state agencies, departments, boards, commissions, and other entities or officials under the governor's control from requiring a person to present a COVID-19 vaccine passport in order to enter a government building, receive a government benefit, or do business with the government. The order provides clear exemptions for nursing homes, assisted living facilities, and long-term care facilities. The governor says, since the start of the COVID pandemic, we have provided the people of South Dakota with up-to-date science, facts, and data, and then trusted them to exercise their personal responsibility to make the best decisions for themselves and their loved ones. We've resisted government mandates, and our state is stronger for it. She goes on to say, I encourage all South Dakotans to get vaccinated against COVID-19, but we are not going to mandate any such activity, and we are not going to restrict South Dakotans' exercise of their freedoms with un-American policies like vaccine passports. In our state, under God, the people rule, and that is how we will operate for as long as I am governor. The executive order states any rationale for imposing public health restrictions that limit freedoms should be tailored to mitigate a verifiable scientific risk. It said implementing a vaccine passport program could lead to unjustified, non-science-based restrictions on travel, speech, association, and other civil rights. And Arizona Governor Doug Ducey also issued an executive order on Monday, barring the state and local governments from requiring that residents show COVID-19 vaccine passports to enter an area or receive a service. The executive order says state and local governments cannot require a person to provide proof of vaccination as a condition to enter an area or to receive a government service, permit, or license. The order does not affect private businesses, which can still require vaccination documentation as a condition for entry or service. It also does not prevent healthcare and long-term care institutions from requiring vaccination status of a patient, resident, employee, or visitor. Ducey's order stops state and local governments from requiring proof of a vaccine to enter an area or get services. It does not ban private companies from doing so. Healthcare facilities can still require a person to provide their vaccination status. Ducey says he still encourages people to get vaccinated. He says, while we strongly recommend all Arizonans get the COVID-19 vaccine, it is not mandated in our state, and it never will be. Vaccination is up to each individual, not the government. Schools and daycare centers can also require vaccination documentation. South Dakota and Arizona join Florida, Texas, Georgia, and Montana as states that place limits on vaccine passports. The American Civil Liberties Union warns against vaccine passports. They say it can violate Americans' right to privacy and that digital apps would only work for people with smartphones. And a WHO panel also makes a recommendation on vaccine passports. It says people should not need them to enter another country. The panel statement notes that some people do not have access to vaccines yet, and they would be blocked from traveling freely. New York State already has a vaccine passport app, so does Orange County in California. People there may need them to get into certain locations or events, such as sporting events or large social gatherings. And Hawaii is looking into requiring proof of vaccination for people traveling between islands in the state. The White House, meanwhile, has said that the federal government will not mandate vaccine passports. Now let's go into vaccines themselves. Johnson & Johnson has been in the spotlight after 7 cases of low blood platelet levels in combination with rare types of blood clots put the vaccine on pause in the states. So is there a quality issue? The U.S. Food and Drug Administration, or FDA, conducted an examination of one facility in Baltimore, Maryland, where J&J vaccine production was put on pause. The FDA wrote in a statement, the FDA cited a number of observations concerning whether the facility's processes met our requirements and standards. The observations include cross-contamination of vaccine substance and found the building used for production was not maintained in a clear and sanitary condition and not suitable to facilitate cleaning, maintenance, and proper operations. The FDA hasn't authorized the manufacture or distribution of J&J vaccine components at the facility, and none of the vaccines produced there have been distributed in the U.S. so far. J&J released a statement on Wednesday saying that on April 3rd, they announced they would increase oversight of drug substance manufacturing at that facility, including additional controls and personnel to ensure the quality standards of our company and the U.S. Food and Drug Administration are met. The FDA has not authorized the manufacture or distribution of J&J vaccine components at the facility. The FDA will test and evaluate them before potential distribution. So when is the pause to be lifted? Dr. Anthony Fauci says the use of Johnson & Johnson's vaccine will likely resume in the U.S. by the end of the week. He says by Friday we should have an answer as to where we are going with it. I would think that we are not going to go beyond Friday in the extension of this pause. I don't want to get ahead of them, but I don't think that they are going to completely cancel because the data or such, at least from what we see, they're looking to see if there are more cases. While the U.S. is still wary of rolling J&J out, Europe is going full steam ahead. The European Medicines Agency say there is a possible link between these rare blood clots in combination with low blood platelets and the vaccine, but this is not enough for a pause. They claim that the benefits of the shot outweigh the risk. They say in a statement, healthcare professionals and people who will receive the vaccine should be aware of the possibility of very rare cases of blood clots, combined with low levels of blood platelets occurring within 3 weeks of vaccination. The agency said it researched at least 8 reports, including 1 death from the U.S., about cases involving unusual blood clots occurring after the COVID-19 vaccine was administered. The agency went on to say all cases occurred in people under 60 years of age within 3 weeks after vaccination, the majority in women. Based on the currently available evidence, specific risk factors have not been confirmed. They say a warning label should be added for J&J vaccine, adding these rare blood disorders should be considered as very rare side effects of the vaccine. J&J says they will now resume their rollout in the EU, Norway, and Iceland with updated information about the adverse effects in question. Last week, J&J confirmed that it will now delay the rollout of the shot in Europe. South Africa suspended its use of the vaccine in the wake of the U.S. pause. And countries including Italy, Romania, the Netherlands, Denmark, and Croatia put their J&J doses into storage. Now back to the U.S. Biden announced on Monday all Americans can get the vaccine. That is, everyone 16 and up can now get vaccinated against COVID-19. The FDA has not allowed anyone younger than that to get a shot of either of the 3 American vaccines. So what does that mean in terms of schools? More and more schools are requiring students to get vaccinated. Half of the 8 Ivy League schools now mandate vaccination. The other 2 are Cornell and Brown. The 2 universities posted notices on Monday stipulating that all students who plan to be on campus at the start of the fall semester must be fully vaccinated against the virus. Yale University said it will make reasonable accommodations for medical and religious exemptions from the vaccine. Yale also announced that it is considering whether to mandate the vaccines for faculty and staff. Columbia University, in its announcement, said it will provide religious and medical exemptions, as we do for the influenza and measles vaccines, in accordance with New York State public health laws. And Princeton joins the list, but does allow medical and religious exemptions as well. 3 Ivy League schools have not mandated the CCP virus vaccines. Harvard University recommends students be vaccinated, but has not made it a requirement. Dartmouth College has also been encouraging students to get the shot and has offered privileged freedoms to those who have been vaccinated. And the University of Pennsylvania is asking all eligible university faculty, staff, postdoctorates, and students to get the vaccine, noting that it has a vaccine clinic open on its campus. And there is a growing list of schools requiring the shot to set foot on campus. Around 50 schools so far require it, but some do allow medical and religious exemptions. But what do you think? Let me know below. Thanks for tuning in to Deep Dive. I'm Tiffany Meier, and see you soon.